what we wish to show you is saline infusion sonography, because you should start doing in your own clinic. Very simple. We don't do HSG anymore to our patients. All SIS we do, because see, SA you can do in your center, ovulation induction you are doing scan. This will complete to find out what's the problem. Okay? That is one. Second is ovum pickup will be shown to you, observation. Embryo transfer will be shown to you, definitely. And IUI, how we do, all that. So what I want is, because you are too many in number, who are the in-house fellowship doctors for 6 months?
In-house, madam. Advanced fellowship. 4 members, 5 members. Madam? 5.
Yeah. So other than that, many IMA doctors I am seeing. So Hyderabad people, any days they can come. Because see, we will put a message at least 3-4 days before. So we will give preference. What I feel is, when you come for a physical class, people from outside will give them preference, so that they don't have to travel. Understood, no? So just make a list, and we'll get it started by next month. We'll not waste time. Because last it becomes too cumbersome. Okay? You just make a So, and Nagalakshmi is like one organ for me. Really, without her, I can't breathe my lungs like outside. She is in years, once we start spending more time together, and if those people are very good, we start liking them. Because I spend maximum time with her. Yeah, so now with this core physiology of fertility is folliculogenesis. We should have a very clear idea about folliculogenesis. Folliculogenesis, how to begin, I have been telling many ways, but because we don't have much time, I want to cover more. If at all, usually how I don't come too much pre-planned for a class, like I will come and deliver this, no. My classes is by seeing your eyes and seeing your knots. Depending on that, I go fast or I go slow. End of the day, each of your time is of value, and what you learn here, you have to remember. Right? So we'll start. Yes. So most of the time I keep you all interactive. I always believe in mass answers. I don't ask people. No awkward situation. But I want mass answer loudly. Because sometimes I feel it's very good to make mistakes, honest, innocent mistakes. What is there? Everybody, even I make mistake, tomorrow I learn. Nobody is 100% in the graph. No, maybe I am here in fertility. In other things, you are somewhere. In maternity. So we will just be very interactive. So I'll start like this, very, very common things for you to understand folliculogenesis. So I'll start from normal lady, normal cycle, what happens in the body, we have to understand. Right? So I keep it like that. See, basically HPO axis is very important. So now I am trying to get you to the phase of, because all textbooks if you read, they will give you ovarian, they will give you what pituitary does, what hypothalamus does. So I am now getting everything in phase for a clear understanding. We will start from day 21. Okay. So day 21, if you do a scan, simple scan, a lady regular supposed to put a scan, what do you see? In scan in the ovary. Ovary. Very beautiful. Superb answer. Corpus luteum. Wow. Good. This is corpus. Other follicles are also not small. Corpus luteum. Just for you to understand, I call it as a balloon. Inside marble is the primary oocyte. Primary oocyte, but Here already primary oocyte has escaped. I'll just no. This is only balloon corpus luteum. Okay, this supports pregnancy. No, corpus luteum. It is very vascular. It takes lot of color. So now this is ovary. What happens to endometrium then? Luteinized endometrium, very thick. If you see, usually it will be around more than 8 mm, 9 mm, 10 mm. This is what happens in the ovarian axis, uterine axis. We are drawing eggs, ovary, uterus. Okay? You are all with me? Yes. Now I am adding one more, hormones. What does ovary does? What does the corpus luteum? What does it produce? Yeah. So before when we did have scan, there was serum progesterone level. So what is that level when they say? Please, doctor, come.
अंदर कितने चाहिए?
You can sit here. So this corpus luteum secretes both estrogen and progesterone. So anybody knows the value of progesterone? Why it is better to say he has ovulated? Confirmation of pregnancy is 20, but ovulation.
More than 3.
Louder answers are there. More than 3. Yeah, 3. 3 is what some books give. Some books give 5 nanograms per deciliter. This is the value. Progesterone, very important. Right? Estrogen, anybody knows how much of estrogen it is? Why it is? See, if you make mistakes, you will remember better. What is the number? Any number you tell, 1000, 2000, 5000, whatever you want. 300, 350 estrogen. This is progesterone. 5 grams per deciliter. Now, in this lady, pregnancy won't happen. Now, what will happen to this corpus luteum? Collapses, it disintegrates. Corpus luteus becomes corpus albicans. What is albicans? It gets fibrosed. So then, what it is becoming non-functional slowly. See, from day 21, it becomes non-functional. Okay, I do this. It becomes non-functional, and slowly what happens when it is collapsing? It collapses. It's not doing any function now. So what it is? Its function is what? By how? Producing estrogen. See, baby won't see corpus luteum, no. Baby only sees the progesterone and estrogen secreted in the blood. Very simple. So everything, its action is hormones. So now when it is collapsing, what will happen to estrogen? It decreases or decreases? Decreases. Huh? Decreases loudly. When somebody is not functioning, what will they do? Slow down. So estrogen slowly from 300 to 50, 200, like that slowly, it comes to a point. The lowest of estrogen in the body, in the lady's cycle, that is. It becomes, can you guess? Very good. Somebody, who is that? You heard? Good. It becomes from 350 to 50 micrograms per deciliter estrogen. Okay? Usually this happens 7 days. 21 plus 7, 28th day. Means she's just about to get her 28th day. So estrogen becomes very less. Now progesterone, how much it becomes? Less than 1. Very good. We clap for this. 50 and 1 is something we should mug it up. Okay? Progesterone becomes less than 1 nanograms per deciliter. See, when we were in MBBS, now it is in 10th standard also, menstruation definition. Not even 10th, 7th, 8th standard. So, what is menstruation? They all say, in withdrawal of hormone, there is shedding. I tell you very honestly, even MBBS I mugged it so well. First withdrawal, first shedding, first withdrawal, first shedding. Menstruation, two words వస్తుంది. That's all. It is nothing but, see, these hormones are getting withdrawn from the body. So endometrium is upset, it cries, it sheds. You understood, no? Actually, endometrium can't see ovary. Ovary can't see hypothalamus. Hypothalamus. So all are communicated through blood. Values of hormones. So every message is through. Why I am telling this so important is, whatever your ovary is, you should not think endometrium will function nicely. That in between hormones should be nice for the endometrium too, because this is somewhere, this is somewhere. So the communication has to go through blood with hormones. Okay, they are the messengers. So now estrogen is less than 50, progesterone less than 1, endometrium sheds. So the lady gets her periods. This is the definition of menstruation. Corpus luteum demise happens, progesterone from 3 goes to 1, and estrogen from 350 goes to 50. These hormones are lowest in the body normally. Then the endometrium sheds and it cries. So now this is day 1 of the cycle, right? Okay. So how does okay, I will tell you another no. Not enough of this. I am adding 2 more things to the schedule. HPO axis, master gland. What it does now, when this estrogen and progesterone is coming down slowly. See, you should remember like this. Estrogen and progesterone are grandkids. Master gland, grandparents. Parents are FSH, LH. Easy it will be. Then when grandkids are very low, what will happen to grandparents? They'll be, what happened? They'll get suddenly aroused. HPO axis. Then this is coming so less, like, okay, I have to see my grandparents. So they'll start pulsatile. They start pumping. Their function is to always see grandparents. Without them, they can't do. So here HPO axis starts active. Hypothalamo-pituitary. It starts. So releasing hormones from hypothalamus. Yes, that's the grandfather, grandmother. No? They start releasing. Then what happens to pituitary? Parents, they are first go to parents. See, they directly can't go to their grandparents. No, we all do that. No, we tell our parents, don't pamper them. Through me, everything. So like that, FSH has put a clause. GnRH day has to go through FSH, LH, parents. So it starts beating pulsatility, hypothalamus. Then it says, come on, you start getting activated. So FSH and LH, when estrogen is very low, they start increasing in the body. Right? Understood? You're all here till me? With me? Now what happens on day 2? FSH decreases. So now, how are the follicles on day 2? If you see a scan, normally you do scans, no, day 2 scan very important. How are all the follicles? Very good. So all the follicles are less than 10 mm. Ideally, when we see scan, they are around 4 to 6, 7. That is the best. 4 to 6 they are. But it should be less than 10 mm. Right? That is the rule of thumb. Okay. See, if number of follicles, if you do a scan, a lady, you be very, imaginations. You have to start using your imagination techniques. When we do a scan, say suppose a lady has less than 4 follicles on each side, each of the follicles. What do you call them? Very nice. And then anything around 7 to, now to we is not 12 anymore. 20 is the follicles number. More than 20 you will call it as PCOS. Okay? Just see, wherever I get chance I am expanding and covering. So you know what is POR, you know PCOS number, you know now. So now these all follicles are there, which are all very quiet, less than 10. Okay? Now we'll select a nice number, easy for all of us. 49, no, I'll select 9. Okay? Now FSH starts beating because this, why FSH likes estrogen, progesterone. Now how FSH can directly produce estrogen, progesterone? It has to do something. Which are the hormones which produces estrogen and progesterone? Which is that which produces granulosa cells? See, each follicle has a granulosa cell. No, remember this. Each are balloon. Each follicle is a balloon. Each balloon has a granulosa cell and a marble primary cell. Each follicle. Like this, okay? This all balloon is less than 10 mm. Okay? Now, granulosa cell has to produce estrogen. So once FSH starts pumping, each follicle balloon has some receptors called as FSH receptors. Initially, they will have FSH receptors. All the follicles will. Say suppose one follicle have 100, this follicle has, will start like this. One has 5, one has 10, one has 15, one has 20, one has 25. Like that it is not constant. The number of receptors on each balloons vary. Fine? Say suppose one has highest 100. Okay? Like how first rank student already ready with receptors. Something they have worked before. So one little FSH increases in the body, it starts dancing. Chosen one. Because it has receptor. So this word comes, threshold, big word. So much of time I took to understand that word. What is efficient threshold? Threshold. Nothing, it is the receptors on each balloon. That which has maximum receptor has least threshold. You know, little some people like music, no? Little if you put, they'll start dancing without their knowledge. Least threshold for dance. So FSH has one of the follicle which has maximum FSH receptor has the least threshold for FSH. Little raise, it starts, usually it be around 8 mm or whatever. It starts. So what it does when FSH is released for almost 4 or 5 days. So this follicle slowly starts becoming, say suppose we'll keep it as 6 mm. 6 or 6 mm. It becomes next day 7 mm, 8 mm. It starts growing. The other follicles also have receptors. Even they will be starting to grow. Because they also sense no FSH. So other follicles also will be growing 1 mm. Which was 5 mm will become 6 mm. So everything will be grown. Now what happens? So as it grows, this is day 1 of the cycle. We will go to day 5 now. By day 5 something happens and this becomes selection. It becomes more than 10 mm. Which was 7 or 6 or whatever. It becomes more than 10 mm. Okay? The rest are also coming. 9, 8, 5, all there. Okay? Little they are all growing because FSH window period. It is still in the window period because these words are all very important. See, I will tell you very honestly, these classes before every week we used to take. It started like that, long time back. Every week I was here, I used to come and take class. So every topic was covered in bits and pieces. I am trying to go on board and tell you physiology, but if you don't understand, raise your hand and tell me, I will repeat. Or if you feel this is too much enough, pause button, something waste your time. Okay. Now this follicles on day 5 becomes selection happens here. Okay. So once a follicle is selected, it's very clever. It's like a queen. It doesn't want other follicles to come along with it. It has to do something, no? So what it does first thing is it multiplies its own number of FSH receptors. Say it was 100 FSH receptors before, it makes it 200. Right? This is the first thing. FSH receptors start increasing and slowly LH receptors start popping up, coming slowly. It's getting ready. You understood, no? So now what happens? This 10 minutes, and then so now estrogen, if you see somewhere on day 6 or 7, what it does, it becomes around, yeah, so it is 10 or 11, sometime during day 5, estrogen becomes around 75 to 100. See, it keeps increasing on estrogen. What is this granulosa cell? It's when the balloon is becoming bigger and bigger, 10 mm, it is granulosa cells are more. It starts producing estrogen. So at 100, it says to grandparents directly. See, kids are clever, they don't go to parents. Why I am telling all this is for you to remember where what happens. So directly it goes and tells grandparents, I am already come now. Why you want to know? You have to stop now. You are seeing me now, go away. Kids nowadays, they don't want more exposure. Okay, chocolate, give, take, and it says to grandparents, yes, you have to tell parents now to stop. Simply taunting me. I have done my job. Till window period, FSH is being behind teaching. Come on, come. Now I have come enough of class. So then what happens? This is called as negative feedback. It is telling negative things. So that is what is called negative feedback of the follicles through estrogen to HPO axis. Why it does this? Because when this happens, HPO axis becomes spoiled. So GnRH pulsatility stops, decreases, FSH, LH, they become relaxed. Window period is closed. That window which was open, closed. Now what happens? All the other follicles want to come out of the window. But window period closed, all the follicles will get arrested. So now it's very happy. Why? Because it's very clever and cunning also. When FSH comes down, it has more receptors. Even little amount of FSH is enough for it to take off. Understood, no? So now 100 estrogen, now it's very clear, now I have more space to grow. It keeps growing. One. On day 7, this follicle becomes around 14 mm. 1 to 2 mm it grows more. And now, or 7 or 8 sometime, estrogen now from 100 it becomes 200. It's multiplying. So now, when estrogen becomes 200, the LH receptors already started there. Yes. So this is 200 estrogen. Once it comes, now again it goes and tells grandparents, now I have produced good amount of estrogen. You wanted this, no? What grandparents wants estrogen. Estrogen I have produced now. So then for 50 hours it has to show that it is there. It's not only one peak. For 50 hours it has to show grandparents GnRH that they are existing. So once 200 picograms of estrogen, this was actually last year's study, now they say 250 300. Okay? For 50 hours it is constantly exposed in the body. Something happens called as LH surge. So by then it is 8th day, it becomes around 10th or 12th day. Okay? 50 hours is how much? 2.5 days. Understood, no? But then this 14, 16, 17, 18, 20 has been. See, on day 12, 20 mm, then LH surge happens. You understood till here? All of you are here? Yes. Okay. This is very important. So this is called as positive feedback. Okay. So it had, if the same follicle acted negatively, the same follicle said no, I don't want FSH. Same follicle gives a positive feedback to LH, GnRH. So GnRH is controlling, no? FSH is mother, LH is father. Right? So now this follicle has a primary oocyte, marble. Now once LH surge happens, what is LH surge? 10 times of more LH than what it was on day 2. I'll come back to that. If it becomes too much, you tell me. We can take it later. Now LH surge happens. Once LH surge happens, locally little progesterone starts raising just before LH surge. Progesterone is why is it important? Because it is a central factor. Local factor like prostaglandins, interleukins, growth hormones, growth factors, all that will work and start eating this balloon. It's not like, you know, one balloon you take one pin and it opens. It is a slow action for the balloon to open. I tell you, this follicle, which is the chosen one, will be in the center usually. You see your scans. Slowly it start coming to the medulla. From the medulla to the cortex. It is so intelligent. As estrogen is the only work for it is to come out. So it goes between all follicles, comes and stands there, so that local. Now LUF, if you say, maybe it's not come to the corner. It is some, so many things are like this. Maybe LH receptors it has not developed, because what is LUF? The trigger has to happen. LH is not able to break that follicle. That is LUF. So much of minor things happen in the body, right? So now it, prostaglandin, everything works and this comes out. Opens. It simply won't open. It wants a kiss from what? Where does the, when it opens, something has to be there to take the primary oocyte, no? Fimbria. It waits. Very clever it is. When it opens, it wants fimbria to hug it. So that primary oocyte, marble, nicely goes into the fimbria and it goes to the ampullary part of the tube. And it stays for how many hours? Yeah, some books say something. It's 12 to 36 hours. Okay? It stays here. Primary oocyte, marble. No? This marble, you know, when it was stored in the body? Primary oocyte. 20th week in utero. When this girl was in her mother's uterus, it was a primary oocyte. Granulosa cell is called as the guard of the gate. You know, the whole, it's so beautiful. That's why I get too much mesmerized by physiology. So much of love and affection is there in our, we don't know what's happening in our own body. So already body is full of love and affection. So this granulosa cell which is covering the marble, see when it goes out also marble, it won't simply go. It goes like a bara, it takes cumulus, COC complex we call. Cumulus oocyte complex. You know, no, when radiating picture, Rasi, I was not doing anything. Now when I see books, I feel, wow. That COC goes inside. COC is nothing but that primary oocyte with a part of little granulosa cell here, like this. Still, you know what this tube does to this granulosa cells? It keeps washing the granulosa cell, cleaning it. Come. It cleans the granulosa cells and it makes it bald. Total primary oocyte. Why I am telling this is so interesting. This is a guard of the gate. From the time 20 weeks, it is the primary oocyte is not exposed to the world. It is nicely sitting there just like that. Now when granulosa cell is washed off by the embryo, no granulosa cell. Why? Because granulosa cell has something called as meiosis inhibiting factor, MIF. Each granulosa cell, I will draw here. This is the oocyte. No, each granulosa cell has meiosis inhibiting factor. This is the primary oocyte around the granulosa cell. Now the fallopian tube is cleaning it nicely. So all granulosa cells are gone. Once all granulosa cells are gone, what will inhibit the primary oocyte? Nothing. It is like kids left from the cage. Resumption of meiosis happens. Very important. Because meiosis inhibiting factor is gone. The guard is gone. The gate is open. Now this primary oocytes, once it is to the world, what happens to it? I don't understand. See a lady, when she attains menarche, now to 8 years, 9 years. 9 years में first exposure. And for a lady who is having menopause at 50 years, 50 years it has been stored. Frozen. 50 years में suddenly it comes off to tubes and it sees the world. It sees the world. Now it has to do some work in the tube. The resumption of meiosis happens. So then what happens is, meiosis, that's why, is so many years. Then say that is first. Second, metaphase 2 follicle, we call it as M2 follicles. Just in hours, 24 to 36 hours till the the follicle is there in the tube. It has to show itself. It has simply sperm comes and it won't form a baby. It has to exhibit its talent. Now resumption happens in just 12 to 36 hours. From M1 it becomes M2. Metaphase 2. You know what is it? See, M1 has 46 chromosomes. Now resumption may it has to throw 23 chromosomes because sperm 23 it has to take in. No. So as a polar body it throws it away. Right? It becomes a polar body here. It becomes 23. Just in 12 hours to 36 hours it has to do all this work. Resumption, polar body throwing, waiting for the sperm. Now they are together, husband and wife, whatever. Sperm enters through the tubes. Even it has its own journey, I am not touching. It's also a beautiful journey. How it comes. For a sperm, it is from Kashmir to Kanyakumari. So it comes and then 23 chromosomes in the center spawns a baby. This is a story. Now we'll come to the bed. Crosstalk between the oocyte and the endometrium, seed and soil. All has to happen together. Right? We'll come to the bed. You're all okay till here? Yes. What time, Dr. Saiti, we have to go? By 2 we have to play. That's a very long journey. Okay, until they get too much. I have to finish it in a form, no? So, now endometrium ideally is shedding, we'll come to day 2 now. We'll come to day 21. It was very secretory thick because corpus luteum is still there, thinking pregnancy is there. That bed is waiting, making itself. Now, there is no pregnancy. Then what happens when there is no pregnancy? This primary oocyte has gone. This CL cyst, the balloon is so good, you know, it's waiting. Primary oocytes, pregnancy happens, I'll pump more estrogen, more progesterone, but till 3 months. Because corpus luteum stays till 3 months if it's pregnancy. No pregnancy, it goes fast. See, by day 21 all this will happen. Ovulation has happened on 12th to 14th day, 3-4 days in the tubes, and by day sperm enters during ovulation. Pregnancy happens, so many changes. Till 21 days, corpus luteum will wait from 14th day. It's open already. It started producing all the estrogen, progesterone from two. Normally, okay, on ovulation day, follicle is 20 mm. No, if this day estrogen relation erected, which was 100, 200 it was, no, it becomes 250 now. Each follicles, corpus luteum, this one produces 250 on ovulation day. Ovulation day, each follicles produces estrogen 250. What was 50 before has become 250. Okay. Why it's important? See, IVF we take 10x. Previous day I will write for estrogen hormones. 215 to 10. 2500 means I will see some x I will get. You know? So these are all very much related. So now till corpus luteum 350 it waits estrogen. 300 to 350. Now over 7 days it has weight, no pregnancy. Then what happens? It starts shrinking. 350 say it becomes 300. Then again this story. Shrink, estrogen. Slowly 50, progesterone shrink. Progesterone starts rising here after ovulation. From 1 it becomes 3 or 5. So pregnancy means it increases, it becomes 20, somebody told 20 number, all that is confirmation of pregnancy. Now endometrium will come. Here you are all okay? On day 2, okay, or secretory endometrium day 21. Now it sheds and becomes skin, which was around 10 mm endometrium. It has become now 3 mm, 4 mm, no pattern, nothing, very bad situation for endometrium, crying. Then slowly as estrogen comes, it loves estrogen. Everything, endometrium works only with estrogen. So estrogenized endometrium, then only you have to give withdrawal progesterone. If it's not pampered without prime, it won't. Okay. So this estrogen makes it feel very happy, and around 5th day it becomes little, starting triple line. On 7th day 5 mm. Every day 1 mm it grows, and during ovulation more than 8 mm. Triple line. Sometimes it can be 10 all. So but it is triple line only. See, the very fact that progesterone little increases, from triple line it becomes luteinized. So it starts becoming little darker. On ovulation day, that's why you should see a 3 line. That means you know progesterone has not started in the body. Once progesterone happens, it starts becoming luteinized. Okay, the pattern of endometrium changes. That's how when we do scan, all our doctors, when they just don't talk to patient, put the probe. I'll ask you this question. So you are understood, no? Then it becomes secretory, thick, and then it sheds. Ideally, ovulation time, if it is 10 mm, once progesterone comes in, it gets compacted. Thick and thickness usually should decrease 0.5 mm. From 10 mm, 0.8 mm. If it decreases, don't worry. Compaction is what progesterone exposure does to the endometrium. Fine? Then slowly, if no pregnancy, it sheds. Now, where are we? We finished. We have somewhere done on day 1. HPO axis, if you see, you should get day 1 mm of the week. HPO starts beating. Ovary low, follicles start growing. Estrogen less than 50, progesterone less than 1 on day 1. Day 5, slowly window period is closing. FSH comes down. This other follicles come down, negative feedback goes. Then estrogen from 50 it has become 100. Progesterone is same. Because progesterone after ovulation, just before ovulation. Now on day 7 also important. 7 to 8 you think 8. One follicle becomes 14 mm. Then its estrogen becomes 200 around. Endometrium becomes around 6 mm triple line. Then HPO axis, what's happening? Yeah, now 200 estrogen has sent to HPO axis, positive feedback. And then now after 50 days ovulation time, and by then 14 mm has become 20 mm. So this now follicle is 20 mm, endometrium is 10 mm triple line. Now HPO axis 10 times estrogen more, LH it produces more, it surges. Then endometrium becomes secrete. This is very important. This rounding, this if you know this, you can catch the follicle. See how our iris is. Every follicle is having its own. This one. Forget about one lady will tell follicular pattern, but next month it changes. Moody, like exactly like ladies. When we cry, when we are happy, when we want to do, we only don't know. No plan. Brain is like that. It goes from year to year. Same follicles also. One folliculogenesis last month is different. This month is different. So you can't have a fixed pattern of giving just letrozole 3 days to 7th day for everybody. You have to play around with each follicles or pattern. Fine? So I think I should end it here now. Actually I wanted to tell more, but I can't 4 hours is too much and it's tiring for you also pre-lunch and some people have traveled all the time. So I'll leave you behind with this thought. Folliculogenesis is very beautiful. And I have been, as a student, being trained. If you want to remember anything, very important. Today you read, 24 hours you have to revise compulsory. Another 1 month later, revision. Then it goes to subconscious brain. So please make an attempt to, because this is very difficult to get in one place in one book. I'll tell you, I have read first 100 pages of Gardner, no. For almost 120 times. First time when I read, no, my attitude is I'll sleep on the book. So many times. Physiology means sleeping, no. After hearing 120 times, read, God felt bad. So I integrated everything, HPO axis, in my class, physiology class. So you also integrate in your brain, because that is what will set you pace for your future classes. Right? So having said that, what is it? Today is Tuesday. Have a good day. Have an enlightened day. Thank you each of you. Thank you so much. Physiology, Novak. What I have read is there in Novak. If you read once, no? Yeah, that is very nice. Read only Novak for physiology. Afterwards, you can buy Kamini Rao medicine. Hope we are also planning to start one book, but it will take time. It's not easy. So Kamini Rao's madam's book gives you idea of the of fertility. Fine. And we will keep the group active also. Anything we learn, we put it. And also, before I forget, block your dates. October 11th and 12th. I want all of you to come to Hyderabad. We are having an international conference. It won't be any charge, free of charge. More 2 days we are Friday and Saturday. We are calling international speakers, and we are also having lot of sessions. Thorough revision for you. Right? Sitting in one place, you will be able to understand. Keep your dates. Thank you so much. Thank you. So you decide evening for physiology next. Now ovulation induction based on this. You all decide and say next month we will have 1 more class, or once in 2 months. You can see. I don't feel too much comfortable to take a class in the. But if you still insist, I will tell. But it is, I know how I hear people. So I know similar things because we are all busy people, right? Okay. Thank you so much. Thank you.